Welcome to the WISE e-learning module on the 10 Children's Behavioral Health Principles. There are 10 principles that guide how Washington State operates its Medicaid-funded mental health system that delivers services to children and youth. These principles guide the implementation of WISE and provide the foundation for the practice model and clinical delivery of intensive services. Family and youth voice and choice, team-based, natural supports, strengths-based, collaboration, home and community-based, culturally relevant, individualized, unconditional, and outcome-based. Let's take a closer look at each principle. The first principle is family and youth voice and choice. This principle means that the perspective and preferences of the youth and family are at the center of all activities of WISE. Families determine the supports and services they receive and the details about how they are provided. Planning and implementation are always done with the family in full partnership. There are several direct applications of the family and youth voice and choice principle for WISE. First, family and youth have a voice and choice regarding their participation in WISE. WISE is voluntary. Second, family and youth must be present at all team meetings. Third, family and youth have voice and choice about the types and mix of services they receive in the WISE process. It is important to note that the youth and family-driven principle is part of a continuum that has advanced through history. This continuum starts with professional-driven, then moves towards youth and family-focused, then to family and youth-centered, and are now striving for youth and family-driven. Youth must also be empowered to make decisions about their own care. The definition for youth-guided care became part of the National System of Care values and principles. WISE supports this value that states, young people have the right to be empowered and to be given a decision-making role in the care of their own lives as well as in the policies and procedures governing care for all youth in the community. WISE teams work to empower and honor the voices of both youth and families and recognize that families often will be driving treatment and youth will be guiding their plan. The second principle is team-based. Team-based means that all decisions are made by a collaborative team, not individuals. Team members are chosen by the family and the youth and are connected to them through natural, community, and formal support and service relationships. All team members are valued and their input leads to a co-authored plan that has considered each perspective. The team should be a blend of formal, informal, and natural supports that work together to develop and implement a plan to address unmet needs and work toward the youth and family's vision. The team-based principle is directly applicable to the WISE process. In WISE, all phases and activities are done using a team-based approach called Child and Family Teams, or CFTs. CFT meetings are required at least every 30 days. The next principle is natural supports. In WISE, this means that the team actively seeks out and encourages full participation of team members from the family and youth's network and community. The team utilizes natural supports in all the planning and implementation processes. The care plan reflects activities and interventions that draw on sources of natural support to promote recovery and resiliency. There are 3 types of supports. 1. Natural supports are connected to the youth and family by relationship. 2. Informal supports are connected to the youth and family by community involvement. These supports don't occur naturally, but do things for civic duty, moral, and/or sense of responsibility to do for others. They aren't paid supports. Examples of informal supports include a volunteer such as Big Brother, Big Sister. 3. Formal supports are paid to help the youth and family. Although this may not happen right away, the goal for WISE is that the majority of team members will be informal and natural supports. Natural supports are important and found in many areas of the lives of youth and families. FRANK is a helpful acronym to remember where to look for natural supports: friends, relatives, acquaintances, neighbors, and kids' friends. Another principle is strengths-based. This means that the strengths of the youth and family are a central part of planning. Strengths are assessed, defined, and built upon as pathways to solutions. Strengths-based tells us to view the youth and family in the light of their capacities and to believe that their strengths are an important part of resolving concerns and meeting needs. The WISE team process takes a strengths and needs-based approach. Strengths and needs are foundational ingredients in the WISE planning process. In future modules and training events, you will learn how to use strengths and needs in all phases of WISE and how the CANS, or the Child and Adolescent Needs and Strengths Assessment tool, is integrated into WISE. We have used the word strength a lot in this principle. What is the definition of a strength? A strength is defined as capacity or potential for effective action, something you're passionate about, the ability to resist stress or strain, or a source of power. There are 3 different types of strengths: descriptive, contextual, and functional. Descriptive strengths are adjectives that describe something. For example, she likes to tell jokes. Contextual strengths are strengths used in a story, like she made me laugh during a difficult time. Functional strengths tell us how a strength is useful to someone. Functional strengths are often action-based and related to a skill or capacity. For example, she can use jokes to make friends and keep them. Functional strengths are most helpful in the planning process as they can be applied to more than one setting, help us understand how they are used to meet a need, and give us a sense of how a youth or family operates to resolve concerns. All strengths are important, but functional strengths are the most helpful kind of strength for the planning process. Here are some other key points to remember about strengths. All people have strengths that are unique to them. Success is supported by building on strengths, and they lead us to pathways to resolve unmet needs. It is also important to remember that strengths are present regardless of how many needs we may have. We also use the word need a lot in talking about this principle. What is the definition of a need? A need is defined as something required or wanted, a condition requiring relief, and anything necessary but lacking. Unwanted or big behaviors tell us that there is a need, and these behaviors are an expression of an unmet need. It is also important to note that needs can be evident in all life domains, and just because someone gets a service, it does not mean that their need is met. Needs are not services is a very important phrase to remind us to talk in strengths and needs language instead of problem and service language. A service is something accessed to meet a need, not the need itself. When we talk about services as needs, we don't gain a true understanding of what the real need is. Take a moment to look at the needs versus services example and be aware of the differences. Collaboration is the next principle. This means that the system responds effectively to the behavioral health needs of multi-system involved youth and their families. In WISE, team members will work cooperatively to develop and implement a cross-system care plan. It will be important to consider all of the perspectives and priorities of every team member in the planning process in order to achieve a collaborative and comprehensive cross-system care plan. And although WISE is Medicaid funded, collaboration with systems, providers, stakeholders, and community members is crucial for success. A collaborative and comprehensive cross-system care plan will incorporate the priorities of every team member and system. Team member priorities include education, educational and vocational success, juvenile justice, community safety, child welfare, youth and family safety, mental health, psychological and emotional well-being, primary care, physical health, and family and youth, cultural and spiritual connectedness. The next principle is home and community-based. Youth are first and foremost safely maintained in or returned to their own homes. Services and support strategies takes place in the most inclusive, most responsive, most accessible, most normative, and least restrictive setting possible. This means that services and supports will be provided where the family needs them and promote integration into home and community life. When we keep young people in their communities together with family, it gives them the tools to be successful. In WISE, all services and supports should be provided in the youth and family's own environment, one that they have identified works best for them. WISE seeks to increase access to services that are provided in the family home and in the community where youth and family are. WISE also seeks to decrease the need for more restrictive services that remove youth from their family, their home, and community life. Each youth and family is involved with different communities. These are more than just our neighborhoods and towns. Think for a moment about the communities that you're a part of. The next principle is culturally relevant. This means that services are culturally relevant and provided with respect for the values, preferences, beliefs, culture, and identity of the youth, their family, and their community. Each team member values diversity, is aware of and accepting of differences, and understands the role of their own culture and its influence on the process. In WISE, team members seek to identify and provide services and supports to youth and their family in ways that are culturally relevant to them and responsive to their unique needs. It is important to prioritize this principle and create opportunities for discussion about the relevancy, responsiveness, and appropriateness of services and supports with each CFT. While honoring the larger cultural context, it is necessary for the WISE process to focus on family culture, or microculture. Family culture is developmental, fluid, and ever-changing. It is often influenced by society and events. Additionally, there can be cultural differences between youth and other family members. It is important for team members to seek to understand these family dynamics. There are 3 cornerstones to family culture that need to be understood. They are values, norms, and rituals. Values are the family's purpose for action. It is desirable things that they consider to have worth. Kindness and sacrifice are examples of values. Norms are a guide for living. They are both spoken and unspoken rules that the family operates from. Norms tell a family what is normal behavior within and outside of the home. Rituals are the behaviors and routines of a family that give them a sense of identity and purpose. These can include the way in which they celebrate, spend time together, play games, use humor, and more. It is important to ask yourself questions about the family culture in order to gauge how much you understand their culture and how a family operates. As you seek to understand the culture of a family, it is important to know that some of these aspects are explicit, obvious, and some are deeply embedded, less obvious. Here's a list of some explicit aspects of family culture to consider. Deeply embedded aspects of family culture may be less obvious but are very important. The most important thing to remember is that everyone has blind spots due to our own family culture and experiences. We must be purposeful and thoughtful in our exploration and assessment of each youth and family culture. Individualized is the next principle. It means that services and supports are provided in a way that is tailored to the unique strengths and needs of each particular youth and family. Each family is assessed first and provided with service and supports that are relevant to them. Additionally, these services and supports are altered when necessary to meet changing needs and goals. The WISE model strives to individualize home and community supports so that they are practical, relevant, and effective for each youth and family. The next principle is unconditional. This means that a CFT's commitment to achieving its goals persists regardless of the youth's behavior, placement setting, family circumstances, or availability of services in the community. The team does not view the youth, family, or team as failing when strategies do not go as planned. Rather, they seek to revise the plan as they learn what is or is not effective. The WISE model commits to revising the plan at least every 30 days until a workable plan is discovered. WISE holds the belief that for every youth and family, there is a plan that will be successful. For every lock, there's a key. It is our responsibility to find that key. If the plan does not work, we keep trying until we find one that does. Families don't fail. Plans do. The last principle we will be discussing is outcome-based. This means that the team plans must be measurable and have indicators to let team members know when things are successful. In addition, it means that plans must be updated regularly, evaluated, and reassessed for effectiveness, safety, stability, and permanency are priorities. Every plan must include SMART outcomes. This means that each outcome is specific, measurable, achievable, realistic, and time-limited. In future trainings, you will learn more about constructing SMART outcomes with your WISE team. For WISE, this not only includes a commitment to measuring success at the youth and family team level, it also includes a commitment to measure the success of the WISE program model overall. There will be several outcome indicators and ways in which Washington will be evaluating WISE at all levels. We believe implementing WISE utilizing the Washington State Children's Behavioral Health Principles will reduce the impact of mental health symptoms on youth and families, increase resiliency, and promote recovery, keep youth safe, at home, and making progress in school, help youth to avoid delinquency, lastly, promote youth development, maximizing their potential to grow into healthy and independent adults. Thank you for participating in the e-learning module on the 10 Children's Behavioral Health Principles. The next module is Phases of WISE, Part A.